Ever since the pandemic struck, the COVID mortality rate has been a subject matter of hot debate. There have been several claims and counterclaims on whether or not there was fudging of data related to COVID deaths, whether or not there was undercounting and misreporting. The government of India has completely rubbished all claims that even remotely suggested that the COVID death figures released officially by the government were only the tip of the iceberg. But a new study has now emerged which has once again put India on the global map. This time again for undercounting COVID death numbers. The study published by the Lancet, which is one of the world's oldest and best known medical journals, has stated that India had the highest numbers of cumulative excess deaths due to COVID-19. The study looked at the excess mortality from COVID-19 pandemic in 191 countries and territories and 252 subnational units for selected countries from January 1st, 2020 to December 31st, 2021. According to this study, 4.07 million, that is 40.7 lakh cumulative excess deaths had taken place in India, which was the highest in the world. This was followed by the US at 1.13 million, Russia at 1.07 million, Mexico at 798,000, Brazil at 792,000, Indonesia at 736,000 and Pakistan at 664,000. This is a stacked bar chart of regional distribution of excess deaths for 2020 to 2021. And this is where the South Asia region stands in the chart in comparison to the other regions in the world. India seems to be the worst affected. The study has found that the figures are indicative of undercounting of the true mortality impact of the pandemic. Mortality varies by time and location, and its measurement is affected by well-known biases that have been exacerbated during the COVID-19 pandemic. The report states that other factors including political considerations appears to have prevented accurate reporting of deaths in some locations. The study has found that mortality impact of COVID-19 pandemic has been more devastating than the situation documented by official statistics. So why are these studies and statistics important? Mortality statistics are fundamental to public health decision making. Strengthening death registration systems is very critical to public health for any country and is necessary for improved monitoring of the pandemic. But like many other reports in the past, the Government of India has junked this report too. In its response to the Lancet report, the Ministry of Health and Family Welfare issued a statement titled "Study published in an international journal claiming COVID-19 mortality in India is higher than official counts, is speculative and misinformed, and the authors themselves admit to several methodology flaws and inconsistencies." The ministry in its statement has said, often these studies involve taking a relatively small actual sample and extrapolating the result to the entire population. While this may achieve near accurate results for a small homogeneous country or region, such techniques have failed repeatedly to give reliable results for a large, diverse population. The study takes into account different methodologies for different countries, and for India, for example, data sources used by this study appears to have been taken from newspaper reports and non-peer-reviewed studies. This model uses data of all-cause excess mortality created by another non-peer-reviewed model as an input, and this raises serious concerns about the accuracy of the results of this statistical exercise. The government has also said that the reporting of deaths is regularly done in a transparent manner and is daily updated in the public domain. That apart, what the Government of India is asking is that when there are financial incentives in India to report COVID-19 deaths, as families are entitled to monetary compensation, why would there be underreporting? So was there underreporting of COVID deaths in India? Let's refresh our memories and go back to the month of April last year. This was a story we had reported in April on how hospitals in the national capital were flooding with COVID patients and dead bodies were flooding burial grounds and cremation centers. This was also the time when several hospitals were being blamed for indifference and absolute neglect of COVID patients.
कल रात को 3:13 पे मिसेस संगीता जैन की डेथ हो गई थी। 5 शमशान घाट जा चुके बॉडी ले लेके, लेकिन किसी ने ये नहीं बोला कि यहाँ पे जगह है, यहाँ पे आप अंतिम संस्कार कर सकते हो। और डेथ किस वजह से हुई? कल शाम को जीटीबी हॉस्पिटल में 5 बजे ऑक्सीजन खत्म हो गई थी, जो रात को 8:30 बजे ऑक्सीजन सिलेंडर आया है। पेशेंट का हमारे पास व्हाट्सअप भी है कि उन्होंने हमें व्हाट्सअप भी कराया कि यहाँ पे सिचुएशन क्रिटिकल है, हमें यहाँ से ले जाओ, बट छुट्टी दे दो। हमारे पास मैसेज भी आए हैं,
इनका बड़ा डॉक्टर था, उसने
छुट्टी भी नहीं दी। वहाँ पे कोई अटेंड करने के लिए कोई डॉक्टर ही नहीं है वहाँ पे, लेकिन डिस्चार्ज करने के लिए हमने उनको बोला तो छोड़ के चले गए कि आप अपना मरो।
और वही हुआ, 3 बजे उसकी डेथ हो गई।
The allegations apart, what was noteworthy in this report was the statistics released by the Delhi government regarding the deaths. For instance, on the 19th of April, according to the government, there were 240 deaths in a span of 24 hours that day. But we found that the situation on the ground was completely different. In Nigambodh Ghat alone, on the 19th of April until 5 pm, 149 dead bodies were brought in, out of which 80 were confirmed COVID deaths. Amongst the rest of the deaths, some family members had alleged that they were sure that the death had occurred due to COVID, but they couldn't get their family members tested. In one cremation site alone, if there were 149 bodies that were brought in, the question is, how many dead bodies were brought into other crematoriums and burial grounds in Delhi on the 19th of April? Could the 240 deaths, the figures that were released by the Delhi government, be true in such a scenario? Let's listen to these Delhi residents.
और कल जीटीबी हॉस्पिटल के अंदर 400 प्लस डेथ हुई हैं।
ऐसा है, जो कोविड जो ब्लॉक है ये हमारा पिछले साल से चल रहा है। पिछले साल अप्रैल में ये ब्लॉक हमें दिया गया था कोविड के लिए। जब से चल रहा है तो तकरीबन इसके अंदर 1000 से ऊपर डेड बॉडी उस टाइम से अब तक दफन हो चुकी है। अब दोबारा से ये नई लहर शुरू हुई है, उसकी भी बॉडी हम इसी में दफन कर रहे हैं, तो इस हिसाब से ये जगह कम पड़ रही है अब हमें।
This was also the peak of the pandemic, when we had reported gut-wrenching stories like this one, where we saw dead bodies being burnt in the parking lot of the Ghazipur Shamshan Ghat as they had run out of space.
ये सुबह कमिश्नर साहब भी आए थे, हाँ एमएचओ साहब भी आए थे, मुआयना करके गए हैं। तो डीएचओ साहब ने भी कहा था कि कोई भी ये मतलब कोविड बॉडी आती है, आप उसको संस्कार कराएं, चाहे ज़मीन में कराएं, चाहे पार्किंग में कराएं। पार्किंग तो दोबारा भी बन जाएगी, कहाँ करेंगे प्रॉपर्ली बताइए, जगह नहीं है हमारे पास तो।
This report only showcases a fragment of the problem that the national capital had come to terms with in April last year. Many other news media outlets also reported on several cases of misreporting and underreporting of COVID deaths. For instance, this study by the CSH found that COVID deaths in India was 6 times more than the official count. This report stated that there was underreporting of COVID-19 deaths in most states. The worst was in Gujarat and Rajasthan. The study suggests that Gujarat had massively underreported deaths linked to the pandemic to the tune of 5,722%, followed by Rajasthan, which was to the tune of 473%, Jharkhand 464%, and Uttar Pradesh 228%. This article that appeared in Nature states that the pandemic's true death toll was millions more than the official count. The report states that India has reported fewer than 500,000 COVID-19 deaths, but both the Economist's model and household surveys suggest that real pandemic toll is in the millions. These and several more reports in the past have indicated how COVID deaths were manipulated. The idea behind such studies is to find the missing links and enable governments to plug loopholes so that we can improve our death registration systems, which is very critical to monitoring this pandemic and future pandemics. But for this to happen, governments must first set aside biases and political considerations and look at ways to find solutions to the problem. It is important to know how many amongst us died during the pandemic. These numbers cannot be pushed into the dark oblivion of agendas and propaganda anymore. These numbers represent people who lived amongst us. Denying them dignity in death is defying the very spirit of humility that holds us together as a society. When the near and dear ones of lakhs of COVID victims still live in pain, the government lives in a state of denial. The least one could do is acknowledge that they lived once amongst us and their deaths should not go in vain.